Next is Dr. Aparna RP.
Good afternoon. Today I am going to present our study in which we try to address the question, is pseudoexfoliation syndrome associated with vitreoretinal interface disorders? Pseudoexfoliation is an age-related microfibrillopathy characterized by deposition of protein-like material on the lens, iris and various other ocular and extraocular tissues. And pseudoexfoliation is known to cause anterior segment complications like lens subluxation, glaucoma, non-dilating pupil and weak zonules. And in our study, we tried to analyze whether pseudoexfoliation syndrome is associated with vitreoretinal interface disorders. Ours was a retrospective case control study conducted in a tertiary eye care hospital with study group comprising of patients with pseudoexfoliation and an age-matched control group. We excluded all the patients with non-retinal diseases, high refractive errors, any previous ocular surgeries, any history of the retinal break, uveitis or glaucoma, any advanced cataracts that could affect the quality of imaging, and any collagen tissue disorders or systemic inflammatory diseases. And all the participants has undergone a slit lamp examination, fundus examination and an OCT imaging. And pseudoexfoliation was identified using slit lamp after pharmacological dilatation as grey white flakes on the cornea, pupillary margin or anterior surface of the lens capsule. And OCT imaging done was screened for vitreoretinal interface pathologies, which was defined based on the criteria of the International Vitreomacular Traction Study Group, which epiretinal membrane is defined as the hyperreflective membrane with corrugations along the surface of internal limiting membrane, and the vitreomacular traction as the detached posterior hyalod with attachment at least one point with altered foveal contour and inner retinal layers, and the lamellar macular hall as intraretinal splitting between the outer plexiform and outer nuclei, and full thickness macular hall as a full thickness defect extending from the internal limiting membrane to the retinal pigment epithelium. And the posterior vitreous detachment was classified according to the method of Ukino et al. Into the complete PVD, incomplete PVD and no PVD. And the study group comprised of 91 eyes of 60 patients with pseudoexfoliation and control group 181 eyes of 124 patients without pseudoexfoliation, and the mean age in the pseudoexfoliation was 70 and that in the control was 68. And the rate of the incomplete PVD was 43.9% in the pseudoexfoliation group and 14.36% in the control group. And that of the complete PVD was 5.49% in the pseudoexfoliation group and 3.31% in the control group. And the rate of the posterior vitreous detachment was significantly higher in the pseudoexfoliation group with a p-value of 0.008, which is statistically significant. And the rate of the epiretinal membrane was 29.6% in the pseudoexfoliation group and 16.02% in the control group, and this rate was also statistically significant. And the rate of the vitreomacular traction in the pseudoexfoliation group was 3.29. Even though it was higher compared to the control group, which had only 2.76%, it was not statistically significant. And incidentally, we also found one case each of full thickness macular hall and lamellar macular hall in the control group, but none in the study group. The ischemia, inflammation, collagen tissue defects are known to be related to the pathogenesis of vitreoretinal interface disorders. Similarly, in pseudoexfoliation also inflammation, oxidative stress, collagen and elastic tissue defects are found. Thus, a common pathophysiological pathway contributory to both can be assumed. In a similar study by Seda et al., where they compare the incidence of the posterior vitreous detachment and the epiretinal membrane in unilateral pseudoexfoliative eyes with a contralateral eye and another control group, they found the rates are higher in the pseudoexfoliation group. In another study by McAvey et al., they found that epiretinal membrane are found at a higher rate in pseudoexfoliation patients. And in our study, we analyzed for all the vitreoretinal interface disorders, and we found epiretinal membrane and posterior vitreous detachment are found at a higher rate in pseudoexfoliation group. Coming to the conclusion, the anterior segment complications of the pseudoexfoliation are well established. And in our study, we found epiretinal membrane and posterior vitreous detachment are found at a higher rate in pseudoexfoliation patients. And most of the early vitreoretinal interface disorders are asymptomatic, and therefore early detection and follow-up is very important. This vigilant follow-up of pseudoexfoliation patient for early detection and management of epiretinal membrane and posterior vitreous detachment is essential. And we suggest posterior segment examination of all pseudoexfoliation patients for early detection and management of vitreoretinal interface disorders like epiretinal membrane and posterior vitreous detachment. These are my references. Thank you.
PVD is a normal affair after some years. You have selected only 65 to 70 years old patients. So naturally, I can expect PVD to occur in all those patients. Many patients can have PVD. Yes. Normal persons. How can I say it's because of pseudoexfoliation?
So we have compared a age-measured control group, and we found that it was higher in the rate was higher in the pseudoexfoliation patients. We have taken as almost same age group, age-measured control group, and we, even the
PVD investigated with the OCT only or with even indirect
even with the we did both the fundus examination and OCT screening. Both.
Do you know what is PVD?
Detachment of the posterior vitreous from the internal limiting membrane.
Define now, at least.
It is defined as the detachment of the posterior vitreous from the internal limiting membrane.
Which area? Which part of the vitreous is getting detached? Is it only posterior or anterior?
Posterior.
Not anterior.
Yes.
You know, actual definition is any part of vitreous coming out of its attachment posterior to the vitreous base. You know, vitreous base anteriorly we got 4 millimeter. Know that attachment where the vitreous is very firmly attached. So any part we coming from, that's why we can from optic disc, from macula, from vessels, anywhere they can get detached. You are only concentrating on what macula area only, I think.
Yes, sir.
That's the reason. You would have seen all the other areas also supposed to have examined. Okay.
Yes.
Thank you.
PPD, how do you make out with the examination?
We can see as the V string. If it is a complete PVD, we could see as a V string around the optic disc.
Okay.
You should have shown pictures.
Only OCT pictures.
OCT. You told her we are done in that after the school. The picture should have shown.